let's talk about Bandaids. So I just evaluated a boxer, pretty typical boxer. She's young, less than 2 years old, super active, energetic, happy, excited. The boxer has pretty serious dog aggression with dogs that she doesn't know. It's more of a recent development. And the trainer that they worked with in the past, that they used when she was a puppy, and they called back recently, immediately recommended going to a vet that specializes in medication. I didn't even know that there were vets who specialize in medication. I just thought that was part of their job, but whatever. So that was a recommendation. The trainer hasn't seen the dog in quite some time, and without evaluating the dog at all in person, or really asking too many questions, the answer was to go to a vet and get medication. Awesome. So the general consensus for this dog is that she has anxiety. For whatever ridiculous reason, she has anxiety and aggression, and she needs medication. The dog doesn't have anxiety at all in any way, shape, or form. She doesn't really even have any of the symptoms of anxiety yet. This is what everybody is telling these people, including the vets. The dog has anxiety and it needs medication. So, let's talk about Band-Aids. Because medication is not a solution, it's a Band-Aid. It's not going to fix anything. The issue is something else. The issue is deeply rooted, and there's a reason for it. If you got the flu, would you put a Band-Aid on your arm to make it go away? To make it all better? No, because that's not the solution, because the Band-Aid isn't going to fix what's going on inside. I was told, for those who don't know, by 6 different dog trainers and 2 vets that Karma was literally untrainable without, it's hard to even say it, she was untrainable without medication. Medication is not a solution. It's a Band-Aid. It's going to mask what the real problem is, and you're never going to fix it at all. That's not going to help you. If you have real anxiety, clinical anxiety, there's a reason for the problems. You can't just mask it with a pill. If you had anxiety, like actual clinical anxiety, you can't just pop a Xanax and your anxiety goes away, because it's a psychological disorder. If your dog was dominant or aggressive or anxious or fearful or nervous, popping a pill isn't going to make it go away, because that's not what the problem was. That problem came from somewhere deeper, and you need to know where it came from. Their dog doesn't have anxiety. Their dog is so aggressive on leash because it doesn't view them as being in charge. It doesn't view them as being capable of handling the situation on their own, because when it sees a dog, it just sees it as a threat. If you have a cold, and because of that you have a runny nose, so you take some medication that makes the runny nose stop. Did it make the cold stop? No, the cold is the real problem. The runny nose is just a symptom of the problem. If you want the problem to go away, you have to fix the problem, not the symptoms. Does that make sense? You can't make the runny nose stop and think that the cold is just going to go along with it. That's not the way the world works. You got to fix the real issue at hand, not use a Band-Aid. If you're afraid of spiders, so you just simply avoid all spiders, does that make your fear go away? No. There's always a reason for the problems your dog has. Without knowing what those problems are, you can't fix them. Masking these problems by medicating your dog is not going to fix them. Now, I'm not saying don't use medication, because there's also medication for like medical problems and injuries and stuff. However, as far as anti-anxiety medication goes, I have yet to meet a single dog ever that would benefit from them. I've yet to meet a single dog ever where that would be the solution. Because it's not a solution. If you fix the problem directly, the symptoms will be fixed as well. And I'm saying fixed loosely, because you don't fix anxiety or fix aggression or you don't fix them. You mask it with training, you control it, you manage it, you improve it. When people say things like, my dog is super dominant, how do you fix it? Well, you don't really fix a state of mind. You can change it though. 6 different dog trainers and 2 vets said that Karma was a lost cause without medication, and lost cause was an actual term that a lot of them used. 3 of the trainers said that I should put her to sleep. You know what the real problem was? Karma's biggest issue, Karma's biggest problem, the root of all of her problems, the cause of all of the symptoms, was me. Me. I was the problem. I was the one who was lacking leadership. So, while she had incredible obedience training, she still didn't view me as being in charge. So how would giving her a pill fix that? Just some food or pills for thought.